Hi, I'm here to do the Delegation and Prioritization of Care lecture. So, objectives for this lecture are to go over delegation and prioritization of client care. We're going to discuss the legal implications of making assignments to other healthcare personnel, including assistive personnel. So, if you ever see AP in the PowerPoint notes, that means assistive personnel. Make appropriate task assignments to team members, apply priority setting guidelines to patient care. We'll also look into conflict resolution, and we'll differentiate between the steps in the process of conflict resolution. We'll explain common sources of conflict in the workplace. We'll explore the forms of workplace violence, and then we'll identify appropriate conflict management strategies in the workplace. So, delegation of client of care. So it's defined as the reassigning of responsibility for the performance of a task from one person to another. Delegation involves transferring of authority. So you, as the RN, will have the ability to request another person to do something that this individual may not usually be assigned to do. However, the RN maintains accountability for supervising those to whom the tasks were delegated, and you're also responsible for making sure the task is completed by the person you delegated to. So, concepts of delegation. With delegation, the responsibility of performing the task is transferred, but yet the accountability remains with the delegator. So we kind of talked a little bit about this on the other side, but the context and processes, it's a lot of it's going to be looking at competency validation, and the licensed nurse needs to know what the delegatee. So if you're delegating to the CNA or patient care technician, as a delegatee, you need to know what have they obtained for additional education and training, and you also have to know, you have to validate their competence to perform the care and delegated responsibility. So it's essential that as a licensed nurse, you are comfortable delegating a task to, say, the CNA or patient care technician, that you know their competency and you know that they're able to perform the task that you're assigning to them responsibly. And if you are unsure of that, then that would be a time when you would not be delegating that task. Competency validation should be specific to the knowledge and skill needed to safely perform by the delegatee, as well as the level of who you are, the practitioner, RN, LPN, and then whatever the activity, skill, or procedure is that's been delegated. The main thing to remember is that the licensed nurse who delegates the task will remain responsible for all overall accountability for the patient. However, the delegatee, or the person you're delegating to, also has some responsibility for that delegated activity, skill, or procedure. So, looking into delegation, it can be either direct or indirect. So, direct delegation usually is verbal direction that the RN decides which staff member is capable of performing a specific task, and again, try to be diligent about assigning a task to a staff member that you are familiar with, who has the competency to perform that task. And then there's also indirect delegation, where it's contained in an approved listing of tasks established by an institution. So it can be permitted, depending on specific tasks, by the institution. And that also can vary from institution to institution. So it's good to know as well, oh, can my CNA discontinue IVs? Is that a part of the approved listing of tasks that were established by the institution? So it's good to know that as well. And you do need to look at each individual institution you go to, because it will vary. And then it's also important to note that states and jurisdictions do have different laws and regulations about delegation. And essentially, it's the responsibility of all licensed nurses to know what's permitted in their jurisdictions. So, the delegation process is multifaceted. It begins with the administration level of the organization, including they determine nursing responsibilities. So you have the administration level determining nursing responsibilities that can be delegated to whom and what circumstances. They develop delegation policies and procedures. And then they'll periodically evaluate the delegation process while they're promoting a positive culture and work environment. And then the licensed nurse must be responsible for determining patient needs and when to delegate. So ensure there's the availability to delegate. Always evaluate the outcomes of and maintain accountability for delegating any responsibility. And then finally, the delegate must accept the activities based on their competency level. They must also maintain competence levels for delegated responsibilities, and then also maintain accountability for delegated activities. So you can see that this is a diagram of the delegation processes, and it shows how multifaceted it is in healthcare. So for assigning tasks, the RN may assign a more skilled individual to perform a task the individual is already authorized to do. So some examples of this include you as the RN assign assisted personnel, which would be the CNA, to do vital signs. If the RN asks the CNA to check drainage, this would be delegation as the RN still retains accountability. So do you see the difference there? Because vital signs is a task that's within the scope of practice of a CNA, whereas checking drainage, you can delegate the activity, but you're still going to be accountable for what is documented and what is seen from the CNA or assisted personnel. Now, the RN may not assign an individual to perform an activity outside a job description or the scope of practice. Anything that's kind of the gold standard of delegation with nursing. It's imperative that the delegation process and the jurisdiction requirements be clearly understood so that care is safely, ethically, and effectively carried out. And again, it's your responsibility to know policies, procedures, and delegation tasks for each institution you work for. So here are listed some tasks that typically can be delegated to assisted personnel or CNAs or patient care technicians. So vital signs, again, not necessarily delegated because it is within their scope of practice. It's something that they have been licensed to do. They can do skills learned through special training. I know depending on hospital systems, some allow their CNAs to do blood draws, or in the ER, if you're an ED technician, then you can start IVs sometimes. You can even do EKGs, and you can do simple wound care. So again, it'll depend on the facility and what skills they have taught their assisted personnel to do through special training. Other things that you can delegate include measuring intake and output, and then of course other non-nursing duties. Okay, so let's look further into what can be delegated by reviewing the ANA nurse-related principles, and the 5 rights of delegation. So on page 83 of your book, there's a list of the ANA nurse-related principles. And this is just a good guide for you when it comes to delegation. So the principles include the RN has the duty to be accountable for personal actions related to the nursing process. So anything that's in the nursing process and standard of care for the nurse, you're responsible and accountable for. The RN considers the knowledge and skills of any ancillary personnel to whom aspects of care are delegated. So before you delegate, you need to know what the knowledge and skills are of the personnel that you're delegating to. The decision to delegate or assign is based on the RN's judgment regarding the following. So the condition of the patient, the competence of the members of the nursing team, and the amount of supervision that will be required of the RN if the task is delegated. The RN also uses critical thinking and professional judgment when following the 5 rights of delegation delineated by the National Council of State Boards of Nursing, or the NCSBN. The RN recognizes that a relational aspect exists between delegation and communication. Communication needs to be culturally appropriate, and the individual receiving the communication should be treated with respect. Communication is a key part of delegation. Chief nursing officers are responsible for creating systems to assess, monitor, verify, and communicate continuous competency requirements in areas related to delegation. And then RNs monitor organizational policies, procedures, and job descriptions to ensure they are in compliance with the Nurse Practice Act, consulting with the State Board of Nursing as needed. There's also the 5 rights of delegation, which include the right task. So the activity falls within the delegatee's job or is included as part of the established written policy and procedures of the nurse practice setting. So is it the right circumstances? So the health condition of the patient must be stable. If the patient's condition changes, then the delegatee must communicate this to the licensed nurse, and the licensed nurse must reassess the situation and the appropriateness of the delegation. So if you have a CNA coming to you telling you your patient's heart rate's 150, you need to follow up with that and reassess the situation. Also, the right person. So the licensed nurse, along with the employer and delegatee, are responsible for ensuring the delegatee possesses the appropriate skills and knowledge to perform the activity that's delegated. You need to have the right direction or communication. So each delegation situation should be specific to the patient, the licensed nurse, and the delegatee. The licensed nurse is expected to communicate specific instructions for the delegated activity to the delegatee. So it's a part of a two-way communication, and the delegatee should ask any clarifying questions. The delegatee must understand the terms of the delegation and must agree to accept the delegated activity. And then the licensed nurse should ensure the delegatee understands she or he cannot make any decisions or modifications in carrying out the activity without first consulting the licensed nurse. So whatever you delegate has to be done in that manner. Nothing else can be added or done in addition. And then you also need the right supervision or evaluation. The licensed nurse is responsible for monitoring the delegated activity, following up with the delegatee at the completion of the activity, and then evaluating patient outcomes. I don't know how many times I have delegated a task to a CNA and they are busy themselves, but I always have found that I have to follow up with them. So if I ask them to go empty a drain, chart it in their eyes and nose, I'll always go back and look and make sure it was done. Although I have to say there might be some staff members you work with who are much more trustworthy than others. It all comes down to the fact that it's your responsibility and you're accountable for that charting and that patient care. Okay, The other thing I forgot to mention was the right supervision or evaluation. So again, you are responsible for monitoring the activity, following up with that. Be ready to intervene and available to intervene as needed. Again, you're responsible for communicating patient information to the delegatee, and the delegatee is also responsible for communicating patient information back to you. And then the licensed nurse should ensure appropriate documentation of the activity is completed. So some guidelines for delegation, the employer nurse leader responsibilities. So the employer must identify a nurse leader responsible for oversight of delegated responsibilities for the facility. The designated nurse leader responsible for delegation must determine which nursing responsibilities can be delegated to whom and under what circumstances. Of course, policies, procedures for delegation must be developed, and then the employer and nurse leader must communicate information about delegation to the licensed nurses and the assisted personnel and educate them about what responsibilities can be delegated. So all delegatees must demonstrate knowledge and competency on how to perform a delegated responsibility. The nurse leader is responsible for delegation along with other nurse leaders and administrators within the facility, and they must periodically evaluate the delegation process. And then the employer nurse leader must promote a positive culture and work environment for delegation. So just as the nurse has responsibilities among delegations, so does nurse leaders. And they're responsible really for creating the policies and procedures for delegation, for continuously looking at them, updating them, and then ensuring that everyone is aware of what responsibilities and what tasks can be delegated, and they need to know what knowledge and competencies are required. So, licensed nurse responsibilities. So the licensed nurse must determine when and what to delegate based on the practice setting, the patient's needs and condition. Again, the state jurisdiction's provisions for delegation and the employer policies and procedures regarding delegating a specific responsibility. The licensed nurse must communicate with the delegatee who will be assisting in providing patient care. And then the licensed nurse must be available to the delegatee for guidance and questions. So including assisting them with their responsibility if necessary, or performing it for that person if the patient's conditions or other circumstances warrant doing so. Now, some of this might sound repetitive, but it's an extremely important part of delegation. We want to make sure that you understand. Make sure you follow up with your delegatee and the patient. So even though, and I've had this happen too, where sometimes they come back and say they did a task, and you go and talk to your patient, and the patient's like, no, I haven't had this done. There's still that concern that sometimes even though you delegate, the person says they did something that they didn't do. So good idea to check in with the patient too after the delegated responsibility has been completed. And then it's also good for the licensed nurse to provide feedback information about the delegation process, and if there's any issues regarding delegatee competence, especially with the competency level of specific staff, and then communicate that with the nurse leader, because if it's something that you feel should be a delegated patient care task that most every CNA should know how to do, and they don't know, then maybe there is something that the nurse leaders need to be aware of to educate staff so that they're brought up to speed. So the other thing is the licensed nurse cannot delegate nursing judgment or any activity that will involve nursing judgment or critical decision making. Nursing responsibilities must be delegated by someone who has the authority to delegate, which is a registered nurse. The delegated responsibility needs to be within the delegator's scope of practice. That's huge, so remember that scope of practice. Okay, so what are the responsibilities of the person you're delegating to? So we talked a lot about what are the nurse's responsibilities, but the person you're delegating to also is responsible. So they must accept only the delegated responsibilities that he or she is appropriately trained for and educated to perform and feels comfortable doing so, given the specific circumstances in the healthcare setting and with patient's condition. The delegatee must maintain competency for the delegated responsibility. The delegatee must communicate with the licensed nurse in charge of the patient. And then once the delegatee verifies the acceptance of the task or the delegated responsibility, then they are accountable for carrying out that responsibility correctly and completing it timely and accurately documenting it per facility policy. Okay, criteria for safe delegation includes reviewing the potential for harm, complexity of the task, problem solving, and innovation necessary to complete the task or activity. The nurse exercises informed judgment and uses individual competence and qualification as criteria in seeking consultation, accepting responsibilities, and delegating nurse activities to others. So on page 87 of your book, there is the delegation decision-making grid, figure 6.1. It was developed by the National Council of State Boards of Nursing, the NCSBN, and it is a great tool to use that was created to help nurses delegate appropriately. So it's something to look into, especially as a new nurse and trying to figure out what are some tasks that you are able to delegate. And then two, facilities can look at this and who's responsible for writing the guidelines related to the scoring. So another thing to guide you and to help for providing safe delegation tasks. So what are some delegation barriers? Well, experience. Older nurses may lack the skill. I think delegation has proved to be a more important part of nursing as time has advanced and healthcare has advanced. So it's possible that older nurses just lack that skill. And then, there's licensure. You worry about the negligence of persons you delegated to. And there's legal issues. So again, refer to your state nurse practice act. The quality of care, maybe it's not as high of quality if you don't perform it yourself. There might be some barriers assigning work to others. Sometimes as nurses, it's hard to not do everything ourselves. It's hard to delegate certain tasks, but it's a matter of trusting your staff and who you work with. And again, distrust with subordinates too. If you don't trust who you're working with, then it can be very difficult to delegate. You also have that possibility you might lose practice performing skills. If you're not doing IVs and you're always asking the IV team to do them, you might lose that practice. You might lose being able to do that skill. And then task performance is easier than teaching or discharge planning. All right. So supervision compared to delegation. So supervision is usually more direct than delegation. It requires direct oversight of the work or performance of others. So this is where you're actually there supervising the person doing it. Delegation is where you're delegating a task and they're allowed to go out on their own and complete it. You don't have to be there supervising them. It also includes checking with individuals during the day. It also may entail delegation of tasks and activities. And then the nurse manager performs both too. All right, so the need for delegation. Why do we need delegation? So changes in the healthcare environment demonstrate the need for delegation. There's shorter patient stays, there's increased acuity of patients, there's nursing shortages. Those are some examples. A lot of times they try to have the assistive personnel or your CNAs or patient care technicians working because they're cheaper labor. They decrease the cost. So if they can have your assistive personnel there to help the RNs, then they won't need as many RNs there to be on staff. Okay, so let's do a quick summary of delegation. So we know delegation is not new. It's been around for a while. I think the role has been progressive. It's essential to have good working relationships. And as a new nurse, you'll find that you can struggle with delegation, and that's normal. That's okay. I think in the beginning too, you kind of want to do everything yourself and learn the task and learn and understand everything that you're seeing in nursing rather than delegate it. But as time goes on, you'll see that delegation is so important with time management. And I'm hoping that the leadership rotation this term really helped at least with making you a bit more aware of how delegation will work with prioritizing care throughout your shift. Um, Organizational skills are definitely a prerequisite for delegation, and organizational skills are something that you will develop once you start nursing care and once you are an RN. It'll be important for you to understand client needs. And again, as you gain more experience, you'll understand client needs better, and then you'll know the appropriate delegation. And then, two, you should always understand the State Nurse Practice Act, all of the national guidelines for nursing delegation, the capabilities of each staff member. And that's a huge one. If you are uncomfortable or are unaware of who you're working with and what their competencies are, then don't delegate a task. And then two, understand the tasks that may be delegated because it's different from each hospital system. And then know and understand the concept of accountability and delegation. And then what each other's responsibilities are. Okay, so let's apply what we learned. What I'll do is I will end this part of the recording so you can work on this activity. It is a website and an article, so there is a post-test for you to review after you have read through the article, and it's just reviewing the material you learned. So go to this website here, the NCSBN, and it's delegation guidelines, and then at the very end of the document is the post-test review. And then once you're done with that, you can click on the next part of this lecture.